Good day, everyone. Welcome, Wamkelekile, to the TDR's Social Innovation in Health's 10-year anniversary, and welcome to Cape Town. It certainly tears at my heart that I can't be with you here today in person in my hometown for this important occasion. My name is Francois Bonnici. I'm Head of Foundations here at the World Economic Forum and Director of the Schwab Foundation for Social Entrepreneurship. Formerly, I was the founding director of the Bertha Center for Social Innovation at the University of Cape Town, where you are now. It's incredible to recognize that we are here to reflect on the past 10 years of the Social Innovation in Health initiative, on the development and progress of social innovation globally as a catalytic tool for development, and to look ahead to the coming decade for the role of social innovation in health. I would like to begin with a special greeting and tribute of thanks to John Reeder, Director of TDR. I know now why it's called a special program between UNICEF, UNDP, the World Bank and WHO, because it required special thinking a decade ago to put trust and faith in researchers, communities, citizens and patient groups and innovators to create systems and services in health to better serve them. Thank you, John, for all your leadership and TDR's leadership, including the Standing Committee and its core partners who have stood by SIHI for all these years. I also wanted to recognize the wonderful SIHI team at TDR who have grown this network and movement globally and driven the momentum. Beatrice, Jean, and all the SIHI partners around the world. Thank you to the Bertha Center for hosting this milestone moment, Dr. Solange Rosa, Dr. Ntombini Marengane, and of course the SIHI champion for almost a decade, Katusha de Villiers. Importantly, tribute must be made to two special people who played such an important part on the SIHI journey but are no longer with us. Firstly, my mentor, the unstoppable Dr. Pamela Hartigan, the former director of the Schwab Foundation and the Skoll Center in Oxford, and the wonderful Dr. Noel Juban, who played such an important role in pioneering SIHI and making Philippines one of its most important pillars. I was born only a few kilometers from where you are now in a public hospital and spent much of my childhood in public hospitals, clinics, patient camps, as both my parents were diabetologists. Their approach to empowering diabetic patients and nurses as the main drivers in charge of their own health laid the seed for recognizing the role of agency and the creation of solutions from those who are living with health conditions and those at the front lines. I also spent my medical school years at the University of Cape Town and my student volunteer times in the clinics of Shoko in Khayelitsha and Nyanga Crossroads, areas in which health services were still being expanded in the early years of democracy in South Africa. As students, we knew we needed to be part of putting the early building blocks towards justice and equity in health, but that communities were already developing solutions to some of the challenges they faced. This was an early lesson that equity and justice are at the core of social innovation, and that it cannot be the responsibility of governments alone for the design and the delivery of equitable healthcare. It's about being not satisfied with the status quo. It's about listening to the needs of people and empowering frontline workers, researchers, and communities to take an active role in improving health system. For me, these were the seeds of dedicating my career towards advancing social innovation and having the privilege to start the Bertha Center for Social Innovation in 2011 with the trust and support of the UCT Graduate School of Business and the Bertha Foundation, an unlikely partnership of a social justice funder with a business school, both recognizing that we needed as much investment and R&D in society as we do in industry. The purpose of the center was to shine a light on the incredible, often overlooked work of community-based solutions to advance public and social goods that traditional research and stakeholders did not recognize or value. The role of a leading university was to provide an important platform for these under-recognized champions, to lend legitimacy, to build evidence, and enable partnerships with public and private sectors to advance their work. The Bertha Center was mandated to identify, research, teach, inspire, and build capacity for a generation of change makers that this country and the world needs in every field. We had started researching health innovations in South Africa, hosted an inclusive Health Innovation Summit with the Minister of Health, together with Lindy van Niekerk and Katusha, and started researching health innovations across several African countries. We were inspired by the Scholes Centre in Oxford and thought, what if this quality specialist centre could bring global knowledge from the South to global audiences? And the partnership with TDR allowed us to build on this dream. With TDR's vision for social innovation, its deep experience in implementation research, and its desire to build research capacity around the world, we were so privileged to help design and develop the first programs and the framework for the SIHI initiative. The rest, as they say, is history. Now with 13 SIHI hubs and research institutions established globally, working towards advancing social innovation in health. The hundreds of models of social innovation that have been studied have shown how locally designed, community-based or last-mile health programs can cover critical gaps in achieving universal health coverage, as well as developing new ideas of how to improve health services and make them more patient-centered. Allow me to return for a moment to my journey. I ended up working all over the world as a doctor, a researcher, program manager in Namibia, Tanzania, India, Mexico, England, Switzerland, and even Iceland, in a range of settings from primary health care to humanitarian and disaster settings to high-end tertiary care. I learned time and again that the amazing miracles of what was possible in health and healthcare was not available to the majority of the world. In 2017, I spoke at the 50th anniversary of the first heart transplant, which took place in Groote Schuur Hospital in Cape Town in 1967. And while celebrating this feat, recognized that despite 5 decades of advancement, investment into research in cardiac surgery, only 10% of the world could really access it. This is echoed in so many other health conditions and highlighted in the 2000s by the 1090 health research investment gap. Since then, we've been making incredible progress in global health research, yet there's still much to be done in who does the research and its influence on the policy development process. The role of TDR in implementation research and the research in social innovation is more critical than ever, as we have a proliferation of strong evidence in almost every discipline to improve health and the quality of life, yet we often fail to deliver the benefits we know should be delivered to all. Having dedicated over 20 years of my career now towards researching, building capacity for, and advocating for this R&D in society we call social innovation, the last 2 years have seen incredible momentum and created a tipping point for us to double our efforts. The work of social innovators and their contribution to improving social outcomes, driving inclusion and sustainability, while positively contributing to the economy, now has global recognition as part of the social economy. The social economy is an umbrella term that includes social innovators in NGOs, cooperatives, social enterprises, and other community-based initiatives that captures their contributions to society and the environment and to the economy. A report we released at the World Economic Forum last year called Unlocking the Social Economy cites research data that the social economy accounts for about 7% of GDP worldwide and up to 10 to 12% of employment in some countries. Suddenly, as governments look towards the Sustainable Development Goals, this is a significant sector that can help drive towards these goals sustainably. In last year, 2022, the ILO and the OECD adopted the first recommendations on the social and solidarity economy. The European Union launched its Social Economy Action Plan with more than €2.5 billion in funding. And the African Union recently adopted a 10-year strategy on the social and solidarity economy. And of course, in April this year, 2023, the United Nations General Assembly adopted the first resolution recognizing the contribution of the social and solidarity economy towards sustainable development. The reason I can't be with you today is that I will be in Brazil with the government to launch their new impact economy strategy and including discussions around bringing the social economy on the G20 agenda under Brazil's presidency. Those in South Africa, please take note as South Africa takes up the G20 presidency in 2025. So after 10 years of SIHI and several decades of advocating for social innovation, we have the global recognition we need. So what is the opportunity ahead now for SIHI in the next decade? In each of your own countries, SIHI partners can build on this international recognition to bring more attention to your work as part of this global movement. You can now also advocate to your governments who have endorsed these resolutions to develop policies recognize, enable, and invest in social innovations and research. In research terms, we need to translate the lessons of social innovation into the mainstream public and also private health systems. This is critical work to ensure we don't get limited by the challenge of scaling individual programs and projects only. We need to scale the ideas, the impact, and the outcome as well. And the research and evidence is key to the translation into policy and program development that puts people at the center and drives universal health coverage and health equity. Globally, there's an opportunity to work with the UN Interagency Task Force for the Social and Solidarity Economy to show the contributions of all the SIHI partners to the implementation of this resolution. We cannot do all this alone, however. The increased recognition will allow us, hopefully, to bring new partners and stakeholders into this network and to partner with SIHI hubs. We must seek further partnerships from national, international organizations, from public and private sector, from philanthropy and even impact investors. But we must not forget to create the platforms and space for people, for patients, for community groups to be the protagonists of this movement. I wish you a wonderful gathering ahead, and thank you for allowing me to be part of this moment today.